Every year, Turkey draws millions of travelers looking to visit its pristine beaches and countless historic sites. But in recent years, the country has witnessed an influx of a different type, those seeking medical treatment. From every type of cosmetic procedure to life-saving treatments, Turkey is hoping to become one of the leading destinations for those looking for medical care. Zeynep Gökçe has the story.
This dental clinic in Istanbul accepts patients from all over the world. And Bora Murat is only one of the Turkish dentists who's trying to keep up with the influx, as dental work has proven to be very popular with medical tourists. While aesthetic procedures top the list, not everyone is after a Hollywood smile. Murat says implant surgery, as well as more complicated applications, are also in high demand. But why have Turkey's dental clinics become such an attraction for foreigners?
Technology means increasing the success of the treatment in a shorter period of time. In this sense, I think Turkish physicians are top in the world. When it comes to developing the tech, Europe and the US are ahead of us. But when it comes to using it, there is a big difference. In the end, this is teamwork. The doctors, the technology, as well as our highly trained technicians and laboratory staff is what makes us stand out among our European and American counterparts.
But foreign patients also come here for other services, including gynecology, internal medicine, general surgery, and the list goes on. This high interest has placed Turkey among the top 10 health tourism countries in the world. The Turkish Statistical Institute says health tourism revenues have reached $2.3 billion in 2023. That's almost $1 billion more compared to 2019. And this is partly because of its internationally recognized health institutions, including this one behind me. The award-winning hospital hosted around 30,000 foreign patients last year, with most of them coming from the Balkans and North Africa. While the demand for robotic surgery and advanced oncological treatments are the highest, stem cell therapies are also very much sought after. Professor Erdal Karaöz is the head of the department. He says this long-debated treatment can greatly improve the life quality of patients with autism, MS, and other illnesses. But the most crucial rule is to pick the right candidate, and then
these cells must be produced at labs approved by the authorized government agency and at ones that meet international standards. When produced in the right way, they can be used in treatments without causing any side effects and complications for the patient.
And this boy was treated for epileptic spasms.
In Austria, where we live, he was actually written off by the doctors. But here in Turkey, with the stem cell therapy, I'm very happy with the results. Before, he wasn't able to hold his head and upper body up at all.
For whichever health issue one is willing to come all the way to Turkey for treatment, what does it take to organize such a trip?
First, they send us their medical request. Accordingly, we are sending them treatment plan. Then we are consulting to our doctor. We are providing their accommodation, transfer process. If they need, also we can arrange visa process. And also we have complication insurance. If they ask for them, also we can arrange insurances as well.
But this isn't always the case. The chairman of the executive board for the Turkish Healthcare Travel Council says scammers can still find ways to trick medical tourists.
The medical facilities, which have been authorized by the Ministry of Health, are announced on its website. Medical tourists who decide to come here for treatment should check from the relevant website if the institution is listed as a medical facility, as well as its authorization on medical tourism to avoid any inconvenience afterwards.
More often than not, medical tourists also stick around to explore the country more, which goes hand in hand with Turkey's Century of Tourism project. The nation's overall target for this year is 60 million visitors with $60 billion in tourism revenue, as it hopes to show off Turkish hospitality not only in healthcare but other sectors too. Zeynep Gökçe, Strait Talk.
And now to further discuss Turkey's health tourism sector, joining me now in the studio is Dr. Emin Cakmak. He is the chairman of the Turkish Healthcare Travel Council. Emin, hello and welcome to Strait Talk. It's good to have you on set.
Thank you very much.
So more than 2 million patients from different nations have visited Turkey. What does this figure tell us about the shape of this industry?
Well, yes, correct. We have hosts from 187 countries, over 2 million patients. Most of them are critical patients, kind of oncology treatment, cardiology, orthopedic treatments. Of course, beside of all these critical treatments and diseases, there is aesthetic hair transplantation and dental care and so many others. But Turkey become really one of the preferred first destination on hair transplantation. The $20 billion and 2 million patients, meaning that in 2030s, Turkey will remain one of the leading preferred destination in the world, which is today the most and preferably preferred destination in 187 countries, from Africa, from Europe, from Middle East, from CIS countries, from all over. Even we have patients from New Zealand, from Canada, all the way from far distance, thanks to Turkish Airlines, of course, connecting us directly to this destination, over 350 destination, means that in 2030, that we will host close to 3 million patients. We can achieve this figure, and we achieve $30 billion direct contribution to Turkish economy.
So what are the main advantages of treatment in Turkey? I mean, why is Turkey becoming a preferred destination for health tourism?
It is very clear two major elements has supported Turkey become a preferred destination. The first element was last 100 years, Turkey since established by Mustafa Kemal Atatürk, the visionary leader, start sending the Turkish young physicians to abroad for their higher education. This was a big vision. Within this 100 year, we have second visionary leader, which is today's president, Mr. Erdogan. He made in his term, from 2001, when he became the first term of prime minister, he has done a great reform in education and on healthcare industry and sector in Turkey. So the 100 years of human resource investment of Turkey, starting from Mustafa Kemal Atatürk, ending with joining with Mr. Erdogan vision on healthcare reform. When the human resources join with investment, infrastructures, technologies, and state-of-art technology and machinery and equipment, of course, Turkey become a preferred destination. Geographical location help us, of course.
Yes.
And the third element, the most important element, is Turkish Airlines expand their flight destination from 50 to 350 destination, from 50 aircraft to 500 aircraft. So the other fourth element, which is help and support the vision of the Prime Minister and President of Turkey today, start supporting the service sectors like health tourism sector, together with the film industry, IT industry. The service sector started a government policy to support incentive-wise for the marketing, for the events.
Today, Turkish hospitals rank second in the world according to the Joint Commission International.
Right.
So how much of a difference does that make in terms of attracting foreign patients?
Well, Joint International Commission International Accreditation and Certification is an American institution, very important on the healthcare sector to be accredited by Joint Commission. And Turkey, after Saudi Arabia, is the second country by the number of accreditation from JCI. We were number one.
Saudi Arabia is ahead of us.
Saudi Arabia become ahead of us because they really almost all hospital now holding the JCI accreditation. But nevertheless, Turkey is a second level, but Turkey is the first preferred destination by world citizen. It's not exaggeration. Okay. Before pandemia, United States was the first, Germany was the second, Turkey was the third. But during the pandemia, so many people and the world witnessed that US and Germany, England, and so many countries been suffered. Italy been suffered, yes. And they could not able to even to serve their citizen in terms of ICU, number of ICU rooms and infrastructures.
Because we also know that Turkey kept its open door policy,
right,
especially
right.
during the COVID-19 pandemic.
You're right.
One last question, I mean, what should foreigners do to protect themselves against scammers?
Of course, this is very important. Turkey is not a third world country. Mm-hmm. Turkey, all healthcare services which we provide in Turkey under accreditation of the Ministry of Health. Mm-hmm. So they are very much controlling the healthcare services and all. But times to times, of course, there is some percentage where you operate. For example, we are number one in the Europe and in the world on transplantation surgery. Yes. We are the number one in terms of number of surgery that we perform for Turkish citizen and for international. But there is always 2% risk on this operation, depending on the patient immunization systems. That's why sometimes it causes some complication. Yes. But always we try to cover this as best way to make comfortable for the patients. But if there is some kind of choice from the international, they need to look at the CV of the doctor, the institution itself, make sure that they are in the right hand, yes. Right place, accredited position, not any unaccredited institution to be treated, because there is some surgery operations without, yes. It is not needed, some big hospitals. So they should do their choice with a general hospital, with general well-known clinics and doctors.
With certificates. So, okay, yeah. Emin, unfortunately, we'll have to leave it here. Thank you very much for joining me on Strait Talk.
Thank you.